Facebook and YouTube Live. I hope you're staying cool wherever you are in the United States. Here in Minnesota, where I live in the Twin Cities, we have been in the 90s and even 100 in the last 2 weeks. And that's really unusual for us Northerners here in Minnesota. I know it's normative in the South, but staying cool and here in my home office, and really looking forward to just spend the next half hour or so helping educators transform the way nursing is taught. My name is Keith, and I am the founder of Keith RN. And my mission is to transform nursing education one educator at a time by empowering educators to transform the way they teach using educational best practices to make them practical, including practical tools such as unfolding case studies written from my lens of current clinical practice. It's great to be with you tonight, and let me know who's out there tonight. And so if you're watching this tonight, just put your name in the chat. Let me know where you're from. And such a blessing to have educators from all around the country and even other parts of the world joining tonight. So thank you again. And I'm excited to share a new resource that I just recently completed and published, and it's a faculty guide to empower educators to develop clinical judgment. It's a PDF document. I also have the spiral bound here. I'll be sharing more about this document later and highlighting some really key principles, just one of many in this Facebook Live. And I want you to know that we're going to basically go on a journey this summer. We're going to take the next several sessions of Facebook Live, and we're going to go deep on clinical judgment. We're going to go talk about defining it, which is our focus for tonight. We're also going to be talking about best ways to teach it. What's the best theoretical framework to develop clinical judgment in our curriculum? How can we practically teach clinical judgment in the classroom, clinical simulation? So if you have got those questions and those splinters in your brain that are keeping you awake at night, you're not alone, and excited to really just keep it real and keep it practical with educational best practices. And so if you go to my Facebook page, Keith RN Think Like a Nurse, you can archive all of these Facebook Lives are going to be videoed immediately and linked. So you can go to the video header right underneath the banner, and you can access the link to this Facebook Live tonight. So this is part 1, ground zero of this series starting this summer. And so if you want to share it with your faculty or other people who would appreciate what I share tonight, please do so. And like the page, and then you'll be in the loop every time we go live every 2 weeks. So for many of you, D-Day is approaching. And what is D-Day? Well, come this fall, if you're teaching a 4-semester program, your students are going to be the guinea pigs, the very first to take Next Generation NCLEX in 2023 in spring. I'd like to know, are you ready? How are you as a faculty feeling right now? I'd love to. I've got my chat open up. I want to say, hey, thanks, Julie. You're from St. Cloud, just about 30 minutes north of us here in Minnesota. Jessica in New Hampshire. Lynn in Florida. Angelina, her AP, or Lynn is in Texas. What a blessing, man. It's I just love the power of the internet being harnessed for good. So let me know kind of where you're at in your journey as it relates to preparing and how you're feeling about Next Gen. Because as you know, the essence of Next Generation NCLEX is simply this: evaluating clinical judgment using case-based scenarios and 6 unfolding questions that represent the 6 steps of the NCSBN model. Now, I want to give you one little kind of a breather here, kind of a little pearl I want to encourage you all with as educators. Do not start teaching the 6-step model this semester or in the fall. Your students, you need to develop the reasoning and the processes of clinical judgment that begin with nursing process and then using Tanner's framework of clinical judgment, using case-based scenarios. You don't have to obsess about the 2 and 3 column matrix, the drop-down close, the highlight, and all of the 5 and 6 alternative next generation format questions, and make sure we have that technology in our Blackboard and Canvas or Moodle or ExamSoft software. Please lighten up. You don't need that. That's needed final semester to prepare your students for NCLEX. Just like you do NCLEX prep, that final semester, focus on those alternative test questions then. For right now, I want to empower you and encourage you, like Elsa in Frozen, let it go, let it go. So anyways, just a thought I really feel strongly about and want to encourage you with in that context. And it's been kind of interesting because in my journey, I integrated Tanner's clinical judgment model and that framework of clinical reasoning in my case studies 9 years ago when I began my journey. And so the case studies that I've developed have Tanner's framework as open-ended questions already embedded. So those tools can really lay the foundation even now. And we're going to talk about that in maybe a 2 or 3 sessions down the road, some of the unique features of what makes a good case study. So be sure to kind of join us for that and keep your eye on this. And so as you look at my story, many of you, I've been doing this, Keith RN, since 2012. It's been a really unique story and a unique journey. And I really feel like, I haven't really shared my story and my journey for a real long time. And some of you as educators kind of just see the website. You see me as the admin of the Facebook group, and you really don't have a sense as far as who is this guy who's a little bit passionate, a little bit too intense at times, but he must really believe what he believes. And I just want to share in the next few minutes my story and my journey because it really has kind of formed me in a good way to kind of be positioned as someone who can really help and empower nurse educators to develop clinical judgment for both practice and licensure. I'm a nurse, been a nurse for 36 years, all of it in acute care primarily. Most of it has been here in the Twin Cities in a variety of settings, but most recently in critical care, ER, and the rapid response team, a critical care circulating nurse in the critical care float pool here in Minneapolis. And, 25 years in my practice, about 2008, I realized I love to mentor new nurses. I'd love to share my knowledge related to cardiac ICU with the ER nurses who didn't know how to read a 12 lead very simply. And I just love to share that, empower them with that information. Well, then I realized, what about teaching nursing students? Why not give it a try? So I did clinical adjunct for a semester, and I loved it at a local ADN program here in Coon Rapids. And, after that, I realized I got to do one thing. I got to get my master's because you cannot teach without the degree. Now, I felt that, I got my master's in nursing education, graduated, pursued my passion, and I was blessed to have a Baylor weekend position, which if you're not familiar with that, it allows you to work every weekend for the encouragement of time and a half. So it's an efficient way to work. But it gave my weekends the ability to work while I could teach during the week. So I was really busy as an educator as I taught during the week and then practiced 2 12-hour night shifts every Friday and Saturday. But, in my second year of teaching, I began to experience the essence of the academic practice gap firsthand. NANDA, 3-part nursing diagnostic statements, lengthy care plans that didn't capture the essence of really how a nurse thinks in real world practice. And I was wondering, these infobesity PowerPoints that I inherited from the last faculty, everybody's doing that. Is it really the most effective way to teach a practice-based profession? Well, then I came across this book in 2011, and many of you are familiar with it. Dr. Benner's work with the Carnegie Foundation, Educating Nurses, A Call for Radical Transformation. And, as I've shared so many times on these Facebook Lives and in all that I do, there's really 3 simple things that we need to do as nurse educators to not only transform the way we teach nursing and transform nursing education. But more importantly, all of these paradigm shifts develop the clinical judgment that our students need for practice. And if you haven't remembered these three, here they are. Number one, bring context to your content. Don't just teach content-heavy lectures. Number two, integrate class and clinical learning. Bring clinical realities into your classroom. Number three, emphasize clinical reasoning. And we'll be talking about this practical, what is clinical reasoning, critical thinking, and clinical judgment, because they're not the same and they're different constructs. But, you know, I recognize that there's one good paradigm, or there's really one good strategy to teach, to integrate all three of these paradigm shifts that are needed to transform how we teach, to develop clinical judgment. And that's a good unfolding case study. So I took my case studies that I wrote that I saw in my practice setting. I changed the names, obviously, and had no violation of HIPAA, but in essence brought real life salient scenarios to my students. And though they did not all drink the Kool-Aid the very first time, active learning's a challenge. By the end of the semester, by halfway through, they began to see the value. And, you know, Linda Caputi was speaking at our Minnesota Health Educators Conference in 2011. And I had a chance to meet her, share my application of Benner's work. And she just kind of was really intrigued, said, send them to me, give me your card. Well, she was the planner at Elsevier's Faculty Development Conference in 2012 that was coming up in about 6 months. They had one spot left open, a breakout session. And I was able to get that. And I had just an everyday educator, passionate to transform my classroom. And Linda gave me an opportunity. And with that, I built a website, very simple, provided tools, case studies, and that's the inception of Keith RN, 2012. And 9 years later, still on the journey, wrote a lot more case studies, collaborated with a lot more educators, and it has been a real blessing. And I'm so thankful to have had this opportunity. And so I really believe I have a platform for a purpose. And, you know, for me as a Christian, I believe that, you know, it's my desire to serve, to shepherd, and to do that with integrity. And that's my passion, and it still is my compass and my true north. And I'm just really blessed to have this opportunity, and want to thank you all for joining me tonight and for doing what you're doing to be part of the needed change. And so as I've written additional cases in 2018, got my PhD, or actually started my PhD studies, graduated in 2020, and my dissertation topic was on unfolding case studies and development of critical thinking, clinical reasoning, and clinical judgment. And so I've really got my head in the literature. The PhD really changed the way I thought and really kind of gave me a context to really strengthen the knowledge of nursing education and using best practices to do so. And so as we look at kind of tonight's topic with clinical judgment, I just want you to know that my PhD has really transformed me. My lens of practice has informed kind of my perspective of what I'm passionate about, to bring practice back into our content as it relates to nursing education, and really just being able to make it practical with these strategies. And so that's the inception of kind of what it all looks like, and what my journey has brought me here 9 years later, and I hope to continue by the grace of God. But as I look at clinical judgment, and I just kind of, for many of you, what questions do you have about clinical judgment? In fact, Melissa says, I'm following my new motto, context for content. And that's actually Pat Benner, by the way. So Melissa, we got to give credit where credit's due. That was straight from Pat Benner's work in educating nurses. But again, well done. And keep doing what you're doing to be part of that needed change. And so if you've got a specific question about clinical judgment, now is your time to put it in the chat, because this is a dialogue. You know, it's kind of, here I am in my home office with a tripod, high-def camera, and you know what, I'm talking to myself, but I got you in the chat right over here. And so I just want to kind of know that, you know, just basically what you're thinking. And as I see anything that comes out, I'll definitely respond to it at the right time. So let's get started. This is where we kind of got to talk about the problem, though. It's like, why Next Gen? What we've identified is about half of the tasks that a nurse does involves making clinical decisions. That's really interesting. Half of all the tasks of a professional nurse aren't tasks. They're thinking tasks. They're making the reasoning, the decisions at the bedside. But yet this is the kicker. According to Kavanaugh and Spida in 2017, a crisis in competency, only 1/4 of graduate nurses, all who passed the NCLEX, met entry-level expectations of clinical judgment. The current NCLEX isn't capturing clinical judgment, and our students are not graduating practice ready with clinical judgment. And that's the real reason that Next Gen is breathing down our necks and why we're having this paradigm change. And this is an opportunity, though, for good. This is where we need to recognize that, yes, it scares us to death. Who wants to see NCLEX pass rates possibly go down? Doesn't have to happen. By doing what Dr. Benner called us to do 11 years ago, we can transform the way nursing is taught, and we can make a difference. Again, just one educator at a time. And each one of you represent part of that needed transformation. I'm your cheerleader. I am kind of that supplier, like on the back lines in battle. I'll supply you with the goods, the case studies, the handouts, the tools. But ultimately, you're the hero, and you're the ones who need to transform. And you're doing it, though it's coming slowly. It's not too late. This is an opportunity, not something to resist. But let it be an opportunity to really get us to change, because that's something we in nursing education struggle to do. So now let's go deep. Let's focus on tonight's topic, defining and understanding clinical judgment so we can teach it effectively. And so we've got to define our terms. And this is where it gets a little bit muddy, because for many of you, I say critical thinking, clinical reasoning, clinical judgment, they're all the same, or they're just synonyms for the same thing. Even some of the articles in the nursing literature will actually say that. And so in essence, they're distinct and they're different. And so let's talk about the distinctions. Number one, let's talk about clinical judgment. Clinical judgment, and this is according to Tanner's clinical judgment model in her article published in 2006, Thinking Like a Nurse, as well as the NCSBN and their definition of clinical judgment. You know what they agree on? Clinical judgment is an outcome. It cannot be taught directly. Think about patient outcomes. In order to have a good patient outcome, do you just kind of hope and pray for a good patient outcome? Or do you have to have a plan of care, nursing interventions, the nursing priority, and the actions that will get you to the outcome? The answer is obvious. It's the interventions that get us to the outcome. And in the same way, you can't teach clinical judgment directly. So what comes before it? Critical thinking and clinical reasoning. And so therefore, what we really need to understand, if we really want to understand and define clinical judgment, and clinical judgment is in essence the decision. It's the decision to respond or not. What do I do? Do I act or do I gather more data? Those are NCLEX questions, but they also capture the essence of clinical decision-making at the bedside. And so therefore, let's go and talk about critical thinking and clinical reasoning that really are really what the interventions that a nurse must do to make the correct judgment. The essence of critical thinking is it requires the nurse to think clearly, precisely, and accurately, and to act on what a nurse knows and understands and are able to apply to the bedside. Now think about that for a moment. Do your students really understand the content? that you're teaching. They can memorize, they can parrot, they can copy and paste, but do they understand? You see, because critical thinking, really the essence is the knowledge that a nurse must use and apply at the bedside. But in order to use and apply the knowledge that you're teaching them so hard, they've got to be able to basically understand it. And that's where too much information, TMI, infobesity, is a killer. That's really, if you want to kind of get down to the what's beneath the waterline of why our students are not graduating practice ready. Most don't even possess the clinical judgment needed for practice, and that's going to get worse with kind of the culture of the pandemic, where the lack of clinical hours are going to impact that dynamic even more. It's really scary. But the bottom line is we're teaching too much content. We're teaching way too much information. And so therefore, we've got to step back and say, what's really need to know for a practice-based profession? That's going to strengthen the critical thinking, because less is more when it comes to knowledge and that deep knowledge of what's most important. And so if we're going to develop clinical judgment in our students, we need to look at our content, how we're teaching it, and how much we're teaching it. You know, we have 100 points, 100 plus slides with our content, and it's way too much information. And our students are like sponges. They get saturated with water, the cognitive vortex gets full, and it's dripping on the floor. They don't remember it. We've got to teach less. So that's a takeaway for us as educators. But it's really important to remember this, that critical thinking is the acquisition that takes place primarily in the classroom. And that's where we need to provide the context as well, that it's not just enough to give them like need to know information. That's part one of critical thinking. But then we have to reason, we have to be able then to apply it with a context. You know, Dr. Benner is a huge advocate of situated cognition as a science of learning theory. In situated cognition, which he talks about in the book, it's big words, don't let it scare you. Provide context to your content. That's it. Nursing's a practice-based profession. Bring the context of the patient care experience to the bedside in your classroom. That's why case studies are one of the most easiest and most effective ways to teach any practice-based profession. That's why med students, they have embraced case-based learning for decades as the dominant pedagogy in medical education. We aren't there yet in nursing education. I hope Next Gen brings us to that place, because there is no better strategy than a well-written unfolding case study. And that's my passion, and that's kind of where I've become an expert on that. But that's for another time. But that's critical thinking. So let's be really clear about that. And when we look at critical thinking, not only is it the content, but I think if there's one area that we want to strengthen in our students that they must understand, pathophysiology. Understanding pathophysiology lays the foundation of the knowledge of interpreting the meaning and the reasoning that a nurse requires to understand, boy, that vital sign, that heart rate's too high. If they understand cardiac output equals stroke volume times heart rate, that basic cardiac output formula, they'll be able to recognize the significance of tachycardia that's trending from 90 to 110 for no obvious reason, but the patient's looking a little bit pale. They'll put two and two together, and they'll develop that thinking for safe practice. So I hope that's clear with critical thinking. If you have questions about critical thinking or anything that I've shared in this Facebook Live to this point, put it in the chat. I'm doing my best. I'm not great at multitasking, so it's like, as a guy, that's a struggle for me, but I will do my best. And Tanya says, I'm transforming my PN class. You know, practical nursing students, you know what, whether you're practical or registered nurse, 2-year, 4-year, We all want to develop the thinking, and that's really where the cases come in, Tanya. So well done. And that's where we can begin in semester 1, fundamentals, laying that foundation in the fall. So when you look at really kind of what you want to do differently come fall, if you're teaching, if you're blessed to have the summer off, is really start looking at case-based learning and strengthening, bringing case studies that you have available to you in your program. So now let's talk about clinical reasoning, because this is the other intervention. This is the other kind of like the nursing intervention that leads to an outcome. And to develop clinical judgment, those two interventions are really critical thinking plus clinical reasoning. So if we understand that critical thinking is really what takes place in our classroom, really we need to strengthen our classroom teaching, because that's ground zero of clinical judgment. If we're giving our students too much information, they're not going to be able to translate that into application at the bedside, and their clinical judgment is going to suffer or not be present. So now clinical reasoning. Clinical reasoning is a skill of critical thinking that evaluates continuously and trends all assessment data and patterns that the data represents to anticipate potential outcomes. The nurse then prioritizes and assesses the significance as expected or as this is unexpected to determine the appropriate action. But in essence, it's the thinking in action at the bedside while providing patient care. And so it's dependent on the ability of the nurse to apply knowledge and reason as a situation changes over time. And those are Benner's definition from educating nurses, those last 2 bullet points. But in essence, that thinking in action and reasoning as a situation changes. Why? What does it mean? What's the significance of that heart rate going up, the temperature going up, the blood pressure trending down? Trending. It's that reasoning and using priority setting, trending clinical data, recognizing the current priority, but you must have knowledge and application of knowledge. You must know your pathophysiology. The critical thinking is essential, because the critical thinking is really the foundation of clinical judgment. Then you build on it with the reasoning that takes place at the bedside. That's why there's no substitute for clinical experience. And that's where our current graduates or our last class are going to struggle, because they didn't get the number of clinical hours they really need to get comfortable and to salient in recognizing kind of some of the things that a novice or advanced beginner, according to Benner's novice to expert, needs to recognize. And so remember this, that reasoning is really kind of where Tanner's framework, and we'll talk about Tanner next in our next Facebook Live, but Tanner's 4 steps that lead to clinical judgment are really reasoning steps. Even though she calls it like clinical judgment model, it's really a clinical reasoning framework that leads to the outcome of a clinical judgment. And those 4 steps of Tanner that we need to integrate into our classrooms, our clinicals, through open-ended questions. And we'll talk about this in the weeks ahead. Step 1 is noticing. What do you notice as you collect your assessment data, as you review the chart, you look at the lab values? What's standing out to you? It's kind of like even some of the Next Gen questions. As I look at some of the NCSBN data, it's like, what is expected versus unexpected? That's Tanner's framework of noticing. Second step of Tanner is then interpreting the meaning. What does this data mean that you're noticing? What does that elevated heart rate mean? They could be going into shock. It's a compensatory response if it's a hypovolemic or septic shock. So interpreting the data, you need to understand the content, you need to understand your patho to interpret data correctly. The third step of Tanner is responding, that plan of care, the nursing priority, and then the reflecting on action and inaction, which is that evaluation aspect, aligns with nursing process. So to want to keep it really simple, if you are emphasizing nursing process and Tanner's clinical judgment framework in your curriculum and in your clinical questions and all that you're doing, you'll be prepared for Next Gen. Just make it intentional and align your content with those two models, and that'll lay the foundation of the critical thinking that your students need for practice. And so really it's kind of like an equation. 1 + 1 = 2. Critical thinking plus clinical reasoning at the bedside, thinking in action at the bedside, equals the outcome of a correct clinical judgment. And really, I'm not trying to say it's that simple, but it really is that simple. And that's where we must, as educators, transform the way nursing is taught so that we can make that difference and put that together. So as we look at takeaways from tonight, to develop clinical judgment, emphasize understanding of essential content, especially pathophys. Then practice, number 2, clinical reasoning. That's the most important skill your students must acquire, is really clinical judgment, but you have to reason, and to reason effectively, there's nothing like a good case study to provide the practice. And that's where simulation is great, but our students don't get enough of it in most programs. Once or twice a semester isn't enough. That's where if you teach case studies, bring those unfolding salient scenarios into your program classroom as application, your goal every time you teach, your students will get the practice. Start in fundamentals for 15 weeks, basic med surg for 15, your specialties for 15, your final semester, 60 weeks, 60 reps. Your students will be well prepared. Again, we don't have to fear. We just have to teach differently. So let me kind of look and see what's in the chat here. And so basically, Vu is saying, I appreciate what you have to say. Critical thinking and clinical reasoning is something I've been teaching, he says. I can't, unfortunately, I can't see the rest of that on my screen, so I have to go back to here. I'm seeing a lot of pushback from students. Students complain that there's too much information in their textbook. Many seem to not want to put in the work. It's so frustrating. Well, Vu, let me just give you this little encouragement. You don't need to teach everything in the textbook. The textbook is TMI, and a chapter is TMI. Vu, I want to encourage you, as well as every educator, you are a filter. When you look at the content that you're teaching in that chapter or 2 or 3 chapters, identify what's need to know for first year generalist practice. And you spit out the rest. You don't have to teach all 100 slides that the textbook publisher gives you. Unfortunately, they don't help us as educators. We have to filter and weed out and have maybe a discussion with our adjuncts and as a team to kind of come together. But let's teach less and not more. But then again, let's have our students read less, not more, but let them read the need to read, not just everything in the textbook. Because as Benner identified with novice nurses, they see everything as equally relevant because they don't have a lens of practice. They think it's all important. Every word in that textbook chapter is like gospel. It's not the case. There's a lot of, I wouldn't call it fluff, but there's a lot of things that our students won't see as first-year generalists. Let's be willing to put it on a diet and make our students really read what's most important to practice. And so Tanya says, so you teach towards the test? No, Tanya. We're going to teach for practice. You see, what I really want to encourage is a paradigm shift in nursing education that's going to prepare them for both practice as well as NCLEX, including Next Gen, is really understanding essential content that's related to practice, not theoretical. That's why NANDA and 3-part nursing diagnostic statements, what was up with that for the last 30 years? That should have gotten short shrift a long time ago. And by the grace of God, we're seeing it finally move on. But we've held on to some things way too long that are not practice-based, not how a nurse thinks, not what a nurse will see or experience in clinical practice. So that's kind of what I want you to understand, Tonya. But no, thank you for sharing that. Great feedback. And so I've got some great comments coming in. Let me just let's go after some of these. This is something that Tammy just shared. They're lacking the Patho, even though A and P is required. And Tammy, I'm kind of curious. In your program, who's teaching pathophys? Is it a nursing professor or is it a science professor? Because that makes a difference. And in many programs, it's a science professor. Nothing wrong with that. But then, Tammy, what it's our job to do in nursing education is to then bring a context of pathophysiology to a nursing perspective. Don't overwhelm them. It's kind of like, when we talk about beta blockers or angiotensin 1 and angiotensin 2 and ACE inhibitors, don't just, all they've gotten is the decontextualized context in a patho course. But do they understand how important that is to understanding the very common medication of an ACE inhibitor that we give all the time for heart failure and hypertension? See, we need to provide the context to the content of pathophysiology. And this is where, as nurse educators, we must understand patho ourselves. And I'm a patho fiend as a critical care nurse, ER. I'm kind of an adrenaline junkie that's getting kind of old and tired. But you know what? Pathophys really lays that foundation. And the bottom line is our students need to understand that. And so just something to kind of just put that in perspective and for your consideration. And Jamie says that your students appreciate the case studies after I teach content, so they put it into a patient. And Jamie, what your students are responding to is educational best practices. Our students are adult learners who want to solve problems. Case-based learning, case studies are a problem that need to be solved. It's kind of like, here's your scenario. Could be 3 different things. What is it? Let's apply our knowledge, because what a case study does, for example, Jamie, that you're alluding to, and why it's so effective, and we'll talk about that in a future Facebook Live, why are case studies so effective for nursing education as well as any practice-based profession, is that it basically provides the context and the opportunity to take what you've learned and now hook it. See, the context of whether it's a patient that you took care of or a case study, it's like a literal hook that takes the content that you've taught, now puts a hook on it, and it embeds it in their brain, that now they have something they can retrieve. They have a real patient that they can apply that learning to, that they'll always remember. They have a case study with the patient's name that is salient and realistic and brings that into practice. And so, no, that's just best practices, Jamie, and your students are just responding to that. So thank you so much for sharing that. And let me just see if there's anything else here. Vu is saying, that's he says that's what we do in our concept-based program, understanding the pathophysiology. They have to have the basic patho understanding to know that clinical reasoning. And so, yeah, it's so true, so true. And, I agree, Stephanie, that case studies are an amazing tool. And, it's not a coincidence, Stephanie, that the Next Gen is using case studies, because a concise case study captures the entirety of nursing process, clinical reasoning, and making correct judgments in the framework of a patient scenario. So Next Gen is just embracing, educational best practices as well, that a case study is the foundation. And I really would love to see case-based learning become more foundational. We've been talking way too long about conceptual learning, and there's nothing wrong with concept-based curriculum. But, at the end of the day, Dr. Pat Benner and others in educating nurses didn't say to transform nursing education, teach concept-based curriculum. They never said that in the book. Yet that's where we've been focusing the last 10, 12 years in nursing education. Concept-based curriculum, concept-based curriculum. No problem, no harm with that. But the problem is we're focusing on the wrong thing. We're not simply changing the way we teach. And here we are 12 years later. with Next Gen, and our students are still struggling to develop clinical judgment. Now, concept-based learning is good. It helps decrease infobesity and content load, simplifies the learning process. So there's some definite benefits, but in and of itself, it is not transformative. It's a beginning, but it's not the end. And I think we've been treating it like the end, like it's the end destination. You still have to change the way you teach a concept-based curriculum. Just some food for thought. And so, yes, Stephanie, I agree that case studies are an amazing tool. And yes, Connie, this will be recorded to share with faculty. And so if you simply go to Keith RN, Think Like a Nurse, my Facebook page, for all that I do with Keith RN, kind of my alter ego. If you go to the banner, and right underneath the banner is videos, everything is there. I've been doing this for over a year now. So got 20 plus other videos, some great content as well from past Facebook Lives. And so this as well will be there. And I hope you check it out. So I'm going to close here with just some closing thoughts here. And what I want you to know is that it's my passion to really provide you as educators with the tools. And one of those things that I just have made available on my website, keithrn.com, is I have a free download titled How Case Studies Develop Clinical Judgment. And what it is, it's a kind of an excerpt from the faculty guide that I've written. It's about 60 pages, and it's about a 15-page excerpt that really just highlights the value of case studies. Go to my website, download that. It's a PDF document, and that'll really lay a foundation of why case studies. You know, we need to understand the why. Just like our students need to understand the why of everything that they do in clinical practice, we as educators need to understand the why. That, I don't want you to follow Keith RN. I don't want you to follow what I'm saying just because it makes sense or you like it. Follow it because it's educational best practice and it makes sense and it's supported by the literature. And that's really what this faculty guide does. And I'm excited to have this as a resource. I also have a YouTube that I just put out. It's only 3 minutes that concisely captures the essence of this Facebook Live on understanding and defining clinical judgment. So if you got 3 minutes, or your faculty would say, well, maybe we wouldn't listen to a 40-minute Facebook Live, do a 3-minute YouTube. That link will here be in the chat, and Amy will pop that in, and I thank you for that. And so if you're looking, though, for the big picture of how you can strengthen teaching clinical judgment and making learning active, bringing context to your content, the Faculty Guide to Develop Clinical Judgment is really my best resource. And this is the paper version. I've got a PDF document on my website for basically the price of less than a case study. You can have really the complete package that kind of covers in part one the essence of the problem, of why we're kind of struggling in nursing education, not really focusing on the negative, but how we can basically change the tide. Talking about Next Gen, the NCSBN model, Tanner's clinical judgment framework, understanding these very important theoretical frameworks. And then part two talks about the evidence of case studies. What's in the literature? I take my dissertation that I blood, sweat, and tears for 2 years is not going to go to waste. I am determined. So I took the essence, and again, making it very easy to read on just basically why case studies can be one of the most powerful pedagogies you can use in your classroom or clinical. And then part three is looking at strategies to teach clinical and classroom and simulation differently. And it's really not changing the curriculum. That's a major overhaul. What Dr. Benner, and really what I've been advocating for the last 9 years as an advocate of Dr. Benner's research, change the way you teach. And when you change the way you teach, you transform your program and develop the clinical judgment your students need for safe practice. But really the two powerful tools that are in this that'll make it worth its price of admission is that I, for the first time, developed a clinical and a classroom faculty guide. They're 2 pages long. And if you're using Keith RN case studies, it'll help you to basically look at any topic you're teaching and how to basically just guide you step by step by step by step to successfully implement it into your classroom or in your clinical or even simulation. The other valuable piece is that I have a glossary of terms. It's about 40 different terms that are in the literature related to clinical judgment that we need to understand and define. And so I spent hours working with a journal editor by the name of Carolyn Humphrey, who's a fellow in the American Academy of Nursing. She's the hero who actually kept my feet to the fire like my dissertation chair and helped me to complete this work. But she said, Keith, you need to define your terms. And so her incredible body of work as a fellow and a journal editor for almost a decade for one of the major journals in nursing education, she really partnered with me and made this resource the best it can be. So I'm really blessed to have her help. And there's a 20% off discount. If you go to the link and just enter the coupon code Transformer, because I want all of you to be transformers by just simply putting this into practice, you can be a part of that. And so the next Facebook Live in 2 weeks will be the theoretical frameworks to develop clinical judgment in the curriculum. What are they? How can we basically be sure we're on the right track with integrating the right frameworks to teach clinical judgment? Clinical reasoning really is what it's about in our curriculum. So I look forward to connecting with you then. And I'm just looking to see if there's any other questions. Jamie says, thank you. I look forward to the next one. Looking forward to more sessions over the summer. And again, these are all going to build on each other. So this is like part one. So if you're blessed to join me tonight live, if not, share the link with your faculty. You know, I really want to just get the word out. You know, this is not about promoting Keith RN and the latest product. It's really just taking the dissertation and the knowledge that I've been given as I completed my PhD studies and what I've learned in my journey as a nurse and nurse educator, and just to share it, to distill it, and to really kind of, you know, build on the body of knowledge, empower educators with that knowledge, and then be the change. You know, every one of you are right where you are for a reason, for such a time as this. And I'm your biggest cheerleader. I am your fan, and I want to encourage you because I know some of you are running on fumes. I almost gave it up. You know, incivility was not unknown to me in nursing education. And I said not once, but twice, screw this, never again. I almost walked away. And there would have been no Keith RN. None of this would have happened had I walked away from my calling. And I just want you to know that if that's you, I want you to know I'm thinking about you, I'm praying for you, and stay the course because you're needed right where you are for such a time as this. And I want to thank you for all that you're doing. It's my pleasure to serve your needs, and I look forward to joining you in 2 weeks as we talk about theoretical frameworks to develop clinical judgment. You guys be blessed. Have a great summer. We'll talk soon. Take care.